A doctor in Danville says he plans to leave Illinois in protest to mandatory COVID vaccines. Illinois adopted a vaccine mandate for healthcare workers in late August. WCIA3's Renee Cooper sat down with that doctor this afternoon. And Renee, he quit his job 3 months ago, and now he's having a hard time finding a job.
Yes, and OSF Healthcare released a vaccine requirement as early as July, actually. It required all employees to be vaccinated by September. Now, Dr. Michael Otney says he tried to give a 4 months notice at that point, and he now plans to leave the state entirely. Michael Otney has been a family medicine doctor with OSF in Danville since 2019. He resigned in August, protesting his workplace's COVID-19 vaccine requirement.
You know, this is medical tyranny.
Otney ended up leaving in September, months earlier than expected. He says OSF gave him notice to wrap up his practice after a patient complained. Otney says that patient asked him if he was vaccinated and was not pleased with Otney's response.
I talked to some recruiters recently. I talked to 2 different ones, and they both told me that it's going to be pretty hard to get me a job here in Illinois without the vaccine. That yes, it's permissible to be tested and all that, but as a new hire, many employers would rather not play with that.
Rather than get the shot, Otney plans to move out of state. He says he holds no ill will toward OSF, but he does not support a COVID vaccine mandate.
I'm anti this vaccine until it gets shook out. Until I know, give me 5-10 years. The best test is the test of time.
Otney says he's keeping a close eye on the long-term risk potential.
So you can't say the risk is 0.
He also points to the fact that most people who get COVID survive.
What about the contagious nature of the virus and the ability to pass it on to someone and them die?
Okay, but again, if you were going to, would you take chemotherapy, which has a particular, side effect profile, just to prevent cancer that you had a 1.6% chance of getting? Would you do it? I don't think a lot of people would.
No, but cancer is not contagious, so I'm just having trouble comparing.
Otney says some vaccinated people still die of COVID, but those deaths account for less than 1% of the state's total COVID deaths. The CDC says, quote, there is no increased risk for mortality among COVID-19 vaccine recipients. I interviewed the Champaign-Urbana Public Health District's deputy administrator about breakthrough cases back in July.
But even in those cases that died or were hospitalized, they had severe underlying health conditions that would have been the primary cause of hospitalization and not necessarily COVID.
Now, as early as June, an American Medical Association survey showed more than 96% of doctors in the U.S. were fully vaccinated. And as of today, an OSF representative tells me 94% of their staff has the vaccine. And she tells me OSF does not release data on the number of employees who left or were fired as a result of the mandate. Live in the newsroom, I'm Renee Cooper, WCIA 3, your local news leader.
All right, Renee, thanks for that report.